Welcome back to Kinesis PT and Performance. Today we will be discussing the misconceptions of hamstring tightness and back pain and why stretching your hamstrings won't necessarily get rid of that back pain. Stay tuned.
My fingers hurt.
Oh, well, now your back's gonna hurt because you just pulled landscaping duty. Anybody else's fingers hurt? I didn't think so.
So a lot of our clients and patients come into the clinic and they have complaints of low back pain, and most of them say it's because they have tight hamstrings. Now, I'm not saying that they don't have tight hamstrings or their hamstrings don't feel tight, but the question is that the root cause of their back pain, or is it just a symptom of an underlying problem? And I argue that it is the latter of that presentation there. So meaning your tight hamstrings are a symptom of an underlying problem. What we're going to do, we're going to have Kayleen turn to the side for us as Vanna White here. She hates when I call her Vanna White, as you can tell. So what I want her to do, show us a nice anterior pelvic tilt here. Boom. So the big lordosis through our lumbar spine here. What that does is it dumps our pelvis forward, and what it does is it takes a bone in her pelvis called her ish tube and it brings it up. So that ish tube is important because that is the attachment site for your hamstring. That's where our hamstring attaches onto our pelvis. So if she stands in a position where she dumps her pelvis forward, we've already created tension on our hamstring. The other thing this position does is it closes down the front of our hip here, so our hip flexors. So these muscles are also going to be turned on, or basically actively contracting to pull us into this position. Our abdominals are going to be lengthened, nice and long, and our low back muscles are going to be short and tight here. Okay, if any of you are familiar with Vladimir Janda, this is a lower cross syndrome. You can Google or YouTube that if you want, but that's essentially what we're discussing here. Now, stretching your hamstrings will not fix this back pain, because if I stretch her hamstrings and make them more flexible, it just allows her to go further into this anterior tilt. Okay, it allows her back to extend further. It allows these muscles in her back to grab on more for hamstrings and glutes that are not firing. So the answer isn't necessarily stretching your hamstrings more. The answer is actually almost the opposite. We need to stretch out the front of her hips. We need to inhibit, rather, not necessarily stretch. We need to inhibit. Inhibit means we need to neurologically turn off, go into the circuit breaker in the brain and turn off these muscles in the front of her hips so we can get her pelvis to come back to neutral. We need to neurologically turn on or facilitate her abdominals, specifically her internal oblique and transverse abdominis, and then we need to help her find her hamstrings, actually contract them so that she can use her hamstrings to pull that ischial tuberosity back down so we can get our pelvis back in a neutral position. That might sound counterintuitive if you have tight hamstrings and low back pain, that we need to work your hamstrings, not stretch them. Again, we work them to help get the pelvis in the correct position in conjunction with the abdominals and inhibition of your hip flexors in the front. Okay, we're just trying to balance stress through our kinetic chain here. Flipping switches in your neurological circuit breaker. That's all it is. Okay, I hope that made a little bit of sense. I know it's a little abstract what we were jumping through there. But as always, if you have questions, we love to talk about this stuff. And again, this is something I see on a daily basis with our clients and patients, and something we talk to about with them every day. If you know somebody that could benefit from this information we just talked about, please share this video with them. Send along our information. We love to help them out. As always, thanks for watching.